Hey everybody, talking a little bit more about recovering after surgery for plantar fasciitis. Typically my patients are on crutches for about 2 weeks, and that's just going to make sure that we're unloading that rear foot so that they're not going to be stressing it too much and making sure that they're in the best position to recover longer term. And particularly because there's a small scar under that posterior plantar heel that I really want to make sure does heal without any opening or dehiscence of the sutures as they're getting back onto their feet thereafter the 2 weeks. Most people are going to be able to get back to work sitting from about 2 weeks. And for me, that's with their foot up, making sure that there's less likelihood of edema or swelling to be occurring there. And then depending on how they're recovering and back into their shoes, standing from about 6 to 12 weeks. Those patients at 12 weeks, that take that extra long time are going to be the people and patients that are on their feet for an extended period of time for their work. It could be our teachers, our tradies, or high impact sort of work where you're maybe jumping out of a truck, for instance. And this is typically the problem with this procedure, because some people do take longer than others to recover, which we do see in a lot of procedures, but you've got to remember that the heel is such a load-bearing area that everyone's using for every step of their day. And that's why they've sort of come to this position and they're unable to undertake a lot of that activity. Typically the pain does get better over time as we're recovering, like most procedures, and so typically people will find their happy medium as they're getting there. But if they're able to rest more so in that first 4 weeks, they're going to find that following further weeks are going to be a much better option for them as far as tolerating their pain. Most of my patients are back in their joggers at 4 weeks. Some do prefer a little bit longer because the shoe is going to guide them. The post-operative shoe is going to guide them in how they're going to, decrease their strain and stress through the foot, in particular the heel. Most people are back to, walking for leisure, around that sort of 8 to 12, 6 to 12 weeks, depending on how they're recovering and their pain levels. And so, keeping that in mind is really important as well, because then most people are going to get back to sports as tolerated around that 12 plus weeks. Some people will do it a little bit earlier, which is great. Obviously had a really good outcome, but we've got to remember that we need to strengthen everything back up so that we're, conditioned to be able to undertake those sports as well. But, love to hear what your thoughts are around this. Please hit the subscribe button, have a look at some of our other videos, but otherwise we'll see you in the next session. Cheers.